Imagine this: a farmer working in the field gets bitten by a snake. He reaches a hospital, anti-venom exists, doctors are present, treatment is available, and yet he may still die. Why? If anti-snake venom is available, why are snake bite deaths still happening in India? This is the question raised by the Hindu editorial Tough Call. And today we break it down in UPSC style. Let's start in Kerala. This summer has been unusually hot, and that matters because snakes are ectothermic. Their body temperature depends on surroundings. As temperature rises, snakes move towards cooler spaces, homes, storerooms, firewood piles, and suddenly human snake encounter rise. Add Kerala's dense vegetation, monsoon breeding season, and high human wildlife overlap, and snake bite risks increase sharply. But here is the surprising part. The editorial says the real issue isn't just snake bite, it's what happens after the bite. Here comes the central argument. Many think snake bite happens, give antivenom, simple. But medicine isn't that simple. About many bites are non-venomous. Many venomous bite may be dry bites, meaning no venom injected. So, not everyone needs anti-snake venom, and overuse is dangerous. Why? Because anti venom itself can trigger severe allergic shock, even fatal anaphylaxis. So, doctor face a difficult call. Treat too early, risk complications. Treat too late, risk death. This is what the editorial calls a diagnostic uncertainty problem. Okay, and here is the bigger issue. India lacks widely available rapid venom detection kits. Doctors often diagnose based on symptoms. This is called as syndromic diagnosis, and the editorial calls it a systemic flaw because by the time symptoms appear, venom may already have caused irreversible change. Okay, the problem is not the absence of treatment; it is delayed certainty. Okay, there is a huge difference between both. And the editorial widens the issue. Even if anti-venom is available, what about ICU beds, ventilators, trained staff, and monitoring labs? If these are weak, treatment outcomes suffer. Okay, and this turns snakebite into a broader issue, not just toxicology, but health system strengthening. Okay, this is a classic GS2 theme. Okay, sometimes public health failure is not lack of medicine, but weak of systems around medicine. Okay, so the editorial makes us rethink snakebite, not as an isolated accident, but as a neglected public health burden. India bears nearly half of global snakebite burden. And who suffers the most? Farmers, rural people, children, the vulnerable, which makes this also a social justice issue. And this is where public health meets equity. Okay, to be fair, Kerala has taken steps. Snakebite is a notifiable disease. There is the SARPA initiative. Awareness campaigns are there. Risk mapping is there. Very progressive. But the editorial says Kerala may be strong on prevention yet weaker on cure side preparedness. And the balance matters. Prevention alone is not enough. Cure system matters too. Through this line, this is what we can derive. Okay, see, prevention is important, but through this editorial, what we can derive is prevention alone is not enough. Cure system also matters. Okay, so What does the editorial demand? Three big things: rapid venom detection diagnostics. This is the game changer. Know early, treat correctly. The second one is stronger hospital capacity, like ICUs, ventilation, skilled staff availabilities. The third is better trained first response decision making, because uncertainty as first contact often determines survival. Okay, and that may save more life than simply stocking more antivenom. Very important. Okay, this is so. What's the big lesson? The editorial teaches sometimes the problem is not shortage of medicine; it is weak diagnosis, weak systems, weak preparedness, and that requires governance reform. Okay, all this requires governance reform, not just medical supply. Okay, and the editorial remind us saving life may depend not on more antivenom but on knowing faster when to use it. Okay, this is the background of this editorial. If you found this editorial breakdown useful, let me know in the comment section. If you have any doubt, put it in the comment section. Thank you.